Today, we're going to talk about global health. The Trump administration began its term with a total withdrawal of the U.S. government from global health. We're seeing in the headlines wholesale dismissal of staff, billions of dollars frozen, no access to data, programs all over the world shut down, and now also massive termination of programs at USAID in particular. We're seeing the effects not just at USAID, we're seeing the effects at NIH, PEPFAR, CDC, and that's not to mention the US withdrawal of the World Health Organization. We're also seeing a pushback begin, or we have for some weeks, as lawsuits mount. And it's a small mountain of lawsuits. There's a litigation tracker I look at. I count more than 80 lawsuits at this point. And full disclosure, AVAC is the lead plaintiff in one of those lawsuits, and that has just moved to the Supreme Court. I do encourage folks to go to avac.org to get the details on that. But what's clear at this point is the Trump administration is trying to test how far they can go. And the outcome of these lawsuits could well determine what there is to salvage in the architecture of global health and what is going to need to be completely reimagined. And here to help us think through all of that is Jen Cates from KFF, a nonpartisan health policy research organization, and our own John Meade, AVAC's senior manager for policy and advocacy. Welcome, guys. Thanks for being here.
Thanks for having us.
Good to be here.
So Jen, let's start with you. You've been tracking what's happening with USAID and PEPFAR and the many executive actions coming out of the Trump administration related to global health. I think there's 11. So when you look at the totality of this past month, how would you describe what the administration's attempting to do, and what are some of the impacts, and what's being contested?
Yes. So as you said, there's been a lot of actions, some of which I think were anticipated, but some of which were not, and certainly not the pace and the scale of what's happening. So I think what is being attempted is a whole scale, ending of much of the global health and development infrastructure and projects and efforts that the U.S. has stood up for decades. And this is being done through, you mentioned some of these things, an executive order that was about rethinking foreign aid, which, on its surface is a good thing, rethinking how we do this work in the world. I think there's been a lot of important conversations, but in practice has been really an ending of most things and letting go of much of the workforce, the federal workforce, and also kind of forcing that in the nonprofit sector that has been carrying out and implementing programs. So where we are today is that whether it's PEPFAR or other global health efforts, they've been kneecapped. They are not really able to function. And you alluded to this, but the other challenge here is it's every moment is something new. And as of yesterday, 10,000 plus awards were canceled at USAID and state. So virtually everything, with very limited exceptions. How to assess what is happening and what's left is a big challenge.
Gotcha. Overwhelming amount of change.
Overwhelming.
Gotcha. John, anything you want to add to that right there?
No, I just want to add that these challenges and these actions from the executive branch is overreach, right? They're trying to see what sticks to the wall, right? And tie these programs up in the courts, right? As we see all of these contests go from court level to court level, all the way to the Supreme Court, it's essentially dismantling the frameworks and the infrastructure that has been built for multiple decades, right? So we may win the ultimate fight in like the Supreme Court or something like months or even years down the line, but the damage is done. The damage is done by firing these thousands of employees. There's no one to run the program. So if there is a waiver or if there is something that is reversed, who's going to run the program? Who's going to release the money? Who's going to oversee the programs? So the damage is done. And I think that is kind of the tactic here, is like the distract and disarm tactic. and wait and see. So they're hoping the courts take their sweet time to adjudicate all of these things. And while it's doing that, while we're distracted by these court cases, the dismantling is happening, the destruction is happening, the devastation is happening to our partners across.
So I think, I think there's what John said. I mean, there's the getting essentially getting rid of the workforce that's been developed over decades. That's the technical experts, the implementers, all the people, many of whom are Americans. So there's that aspect. But I think the a really important thing that we all are focusing on and trying to understand better. There's people that have depended on these programs, and kids, moms, people that are very vulnerable, and again, I think a thoughtful approach to reform is important, and there may be some opportunities for that. So, but this was really like an abrupt cliff, and so real individuals who have relied on the U.S. support for medications, for all kinds of life-saving interventions, are not able to get them, and I think that's the biggest issue at the end of the day.
Gotcha. Yeah. So much to track in terms of both what the administration's doing and the pushback and the lawsuits. Are we seeing any early successes start to emerge in this onslaught of just headline after headline, action after action, pushback after pushback? Any early successes emerging?
I mean, just you mentioned the case that AVAC's involved in, and there's a companion lawsuit brought by the Global Health Council and other organizations, and those cases have kind of been brought together. And I'd say in general, the judge in that case, and the federal district judge, has been pretty strong, saying to the government, you have to stop doing what you're doing. We are evaluating these claims, and we're going to have a full hearing about them, but you can't just stop paying. You can't just cut off aid and harm these organizations and ultimately people that are served by them. But the government has continued to say that it's following what the judge has laid out. So it's created, as John said, it's a back and forth. So it's been, on the one hand, there have been some victories for the plaintiffs on a given basis, but then it gets challenged again. Mm-hmm. And so I think we don't know. And this is not unique to this case. This is happening in many, many cases. There are so many that are being brought right now on a whole range of related and unrelated issues, but raising questions about constitutionality and procedural law and all of these different aspects. But I think it's just too early to say where we'll end up.
Right. Go ahead, John.
Another thing that I see as a success is the community and civil society are coming together, right? In an area where sometimes we might be siloed with different ideas and different ways of going forward. I think in the domestic space is supporting the global
U.S. domestic space, we'll say.
U.S. domestic space is supporting the global space and vice versa, right? There is kind of like a domination and a mobilization that's happening because all of our rights are up for grabs, right? All of our rights are being taken away. It doesn't matter what community you belong to. There is something that is precious to you that is being taken away. And we're all coming together and mobilizing in this time to fight, to resist, right? And I think that is super important. While the court cases and all of that is going on, civil society and the community that these actions are affecting negatively are coming together to galvanize, to strategize, to advocate on what can we do as a civil society, as a community, to ensure that we can do something, that we don't feel helpless, right? That's what they want us to feel, is helpless, right? And yeah.
So it's a moment of solidarity. Yeah. That's what I'm hearing. And Jen, what I'm hearing from you is there's just a giant question mark over what is going to happen with this volume of lawsuits, which is where we're going to see if there's any constraint on the Trump administration and its ultimate effect on global health, which is the focus of our conversation here. It could go any way. And right now it's at an early stage, and it's going to be this iterative results from these lawsuits that are going to help paint that picture, if I've got you right. John, could you go, let's go into the status of the impact on research right now. What's happening with clinical trials? Because that's an area that we track very, very closely. Talk about that, if you would.
Yeah, definitely. So the stop work orders that we've mentioned previously have disrupted USAID supported HIV prevention research, right? It has halted clinical investigations in vaccine and next generation PrEP strategies, right? There are a host of consortia, Brilliant, Advance, Matrix, and Mosaic that AVAC and others organizations are a part of that are looking at clinical, preclinical, and experimental trials testing HIV vaccine candidates, right? MPT, or which is multi-purpose technology products, fast-dissolving inserts, vaginal films, etc., that have been suspended and even stopped, right? These disruptions delay the development of urgently needed HIV interventions and threaten really the sustainability of the research infrastructure all over the world, right? There is an anecdote that I want to mention that was brought up in a New York Times article, right? There was a young South African woman who was part of a USAID funded research study testing a silicone device that both prevents pregnancy and also HIV. Abruptly, she was asked to come into the clinic so that it could be taken out prematurely. And she was like, what's happening? What is going on? Because again, these are actions in the US government. So folks abroad don't really understand what this means for them, right? They don't know what line item their clinical trial that they're participating is funded by. So they're not understanding that a lot of the funds for a lot of the clinical trials are connected to the US government, right? She was asked to come in so that they could take it out because of the stop work order from the Trump administration. And another consequence of this is the fact that there's not broken trust that has been built over decades, right? There is a history of mistrust and distrust when it comes to medical research. Researchers have spent years building the trust of these communities, and in 1 week, it has been obliterated. Right? In 1 week, it has been obliterated. So we need to figure out what we can do, but these clinical trials have essentially been suspended, if not stopped altogether.
And there's an ethical issue here too, isn't there?
Yes, of course, like at AVAC, we push to ensure that these HIV prevention research is done ethically, right? Because these are communities that traditionally and historically vulnerable, right? So we have an ethical responsibility that if an individual starts a clinical trial, that there's a responsibility to continue it throughout. And there is legal and also there's a declaration, Helsinki, I believe it is, declaration that talks about the ethical kind of like obligation of researchers and research institutions to ethically ensure and morally ensure that if a trial has started and an individual is in a trial, that it is completed. Or if there's success shown, that they continue the regimen so that they're not left high and dry.
Right. The way I think about it is people who participate in clinical trials are volunteering their bodies, and you need to protect those bodies if the trial is going to be conducted ethically.
Plain and simple.
The implications are not just for research, they're much broader. Can you talk about what's happening with the NIH, which has been one of the single largest sources of investment in medical research, but that's under threat too? What's happening with NIH?
Definitely. So I'm also the co-chair of the Federal AIDS Policy Partnership Research Working Group. Right? And what we do is we advance and we advocate for the support of U.S. leadership to accelerate HIV research across the government's publicly funded institutions, as you mentioned, NIH. We are super concerned because there is a proposed 15% cap on indirect costs, which will have an impact on U.S. research institutions, particularly state universities that rely on these indirect costs to support medical facilities, salaries, infrastructure, right? And that is being diminished and taken away to 15%. Let me give you an example, right? So the University of Alabama right, received over $400 million in NIH funding and has a federally negotiated indirect rate of 48.5%. Imagine that decreasing to 15%, right? From an economic perspective, the University of Alabama is the largest employer in the state of Alabama, right? So this is affecting gross domestic product, jobs, and it will stunt economic growth. The same is happening in North Carolina, where you have Duke University and the University of North Carolina at Chapel Hill, Vanderbilt in Tennessee. And these are all Republican dominant states, right? And another thing they have in common is they have Centers for AIDS Research, CFARs, which the focus of these centers is to support multidisciplinary research aimed at reducing the burden of HIV, not only domestically, but also globally, right? And we know that HIV research doesn't just impact and help HIV, it helps other disease states as well. Think about the COVID-19 vaccine. Those vaccine approaches and candidates would not have come to market so fast if it wasn't for HIV research at some of these institutions. And now you're going to try to cap the indirect cost down to 15%. It's going to decimate kind of like our state educational institutions' ability to continue this research.
Yes, and so John was just saying, the attempt to reduce the overhead, which would have a huge impact on the research enterprise for HIV and all research, the court has actually issued a nationwide injunction on that, and that is not happening at this time, but that's is another example of something that has to go through the court system. But it points to a larger issue or challenge at hand. There's so many things happening at once. We're very focused on global health and foreign aid, but there's a lot that's happening domestically. And even without this kind of moment, people in the United States, Americans, aren't really always aware of what happens with foreign aid. They always overstate how much is spent on it. It's a percent or less of the budget. Global health is even less than that. But often, I think a challenge that hasn't easily been answered to try to convince or talk to the American people is that they are also facing challenges at home. And so when people are facing economic and other challenges at home, it's hard for them to understand, why are we helping others? And there's a whole range of reasons why we do. But I think that disconnect is one of the reasons that foreign aid and U.S. aid and global health were the first areas to really get attention around the cuts and the cancellations.
And it strikes me that that's a real lesson for civil society to learn and for global health champions to learn, a real lesson about how important it is to be able to keep the public who might be supporting these through their tax dollars, to bring them along. That's what comes to mind. And to that end, John, what is happening in Congress? Do we have congressional champions? And is Congress also another venue for this attack on global health?
Yeah, so there have been a plethora of hearings related to foreign aid and how it isn't part of the America First kind of like paradigm that has been touted by this administration. But we know that foreign aid actually makes America stronger, safer, and more prosperous, right? We have bills being introduced to restructure the NIH, which includes eliminating Fogarty International Center, which supports and facilitates global health research and also build partnerships between the US government and other governments, right? And training the next generation of scientists and researchers, right? As well as there's a proposal to split the National Institute of Allergy and Infectious Disease into 3 separate research institutes, right? What we're seeing from these actions are inserting politics into medical research, right? And that's not the way it should be. And so there are champions in the House and the Senate that are trying to combat all of these bills, but it takes time. Right now, I feel like Congress is trying to figure out what their power is in this new paradigm that we're in, right? Because the administration is trying to take away the power of the purse. They're trying to take away all of these powers that are historically for Congress. So we need to just keep an eye and keep talking to our champions in Congress, and also work with congressional leaders on both sides of the aisle, some that might be more moderate and more understanding to the plight. People in states like Alabama, whose if research is capped at 15%, the economic growth of that state is going to decrease and decline. So really using that angle when speaking to some of the Republican colleagues, but the Democratic colleagues are trying to figure out what they could do to combat all of these.
Right, because so what I'm hearing is the politicians in red states who are being hard hit by some of these moves are potential allies. So, Jen, what about alternative funding, right? As we start to look into the future, what's the potential of alternative funding from for global health, like Global Fund, national governments in Africa, or philanthropic donors? And partly, I want to make sure we understand the stakes here. At least in HIV prevention, we are very aware. We are talking constantly about a historic opportunity to leverage long-acting injectable PrEP that hangs in the balance here. It's totally in jeopardy. It could have a transformational impact on the epidemic, and we're we want to see that. We want to see injectable Len. We want to see injectable cabotegravir get scaled up. So let's hear more about what the alternative funding for global health might be.
So very excellent question that many are asking. I'm afraid I don't have a great answer. I think that the challenge is that this is happening, and it's not an accident that it's happening now. The challenge is that this is happening when all across the globe, especially on the donor side, donor governments, have been signaling and even pulling back from foreign aid, from global health, for a whole range of reasons, whether it's other economic pressures that they're facing, their own constituents, changes in government and leadership, nationalism, all of these factors. But the collective toll of that is that I don't necessarily see another donor government that's going to jump in and save this. And even if there were governments that wanted to, the U.S. has been, for better or for worse, the U.S. has funded most global health in low and middle income countries. That's the area that the U.S. has uniquely carved out, has had the technical expertise, the programs. And so it is not the kind of thing where others can kind of jump in and easily fill that gap. Now, having said that, I think there's some emergency measures that can be taken. I've been heartened to see that several African leaders have come out and said, we know we need to do more. We are going to try to do more. We are going to try to fill some of these gaps. That's a short-term, potentially longer-term solution, but it's not going to fill the gaps. But it's a direction that was needed anyway. I think the risk here, and why I want to just come back to something I said earlier, which is the people that have depended on these programs, the risk is that there are going to be very, very big gaps and not able to totally fill those in. Now, there's a lot of discussion about alternate financing mechanisms and all that, but those are, I'd say, take time and not a given. Yeah.
Could you address the Global Fund, either of you, too? Because that's something that, comes up a lot. And it has not seen cuts yet.
Yeah. So I'll just mention the Global Fund and Gavi for that matter. I mean, these are they're unique in the multilateral space because they're independent organizations. They're public-private partnership, independent organizations that have kind of unique governance models and actually have a lot of systems built into them that sort of force kind of, co-financing, graduation, various things that frankly hasn't happened on the part of the U.S. bilateral programs, but has in these. But they also rely on donor support. They are financing vehicles that raise money from others. So the Global Fund, a third so far of its funding is from the U.S. government. And the Global Fund and PEPFAR have been kind of in lockstep as partners. So there are risks there. You're right. The Global Fund has not seen its funding pull back. I think the multilateral piece is on a slightly different track. But we don't know. And but there, it's as John was saying, they're part of this. I think will be advocates are going to be educating Congress and explaining the different programs and how they work together and what their effectiveness is.
Yeah, and this year is actually just piggyback on what Jen was saying. This year is the Global Fund's 8th replenishment, right? which helps to fund, as Jen was mentioning, not only HIV, but malaria and TB globally for 2026 to 2028. And South Africa and the United Kingdom are the co-hosts this year. So this is an opportunity. And as Jen mentioned, these governments, we don't, and private donors, because the replenishment is governments and private donors. We don't expect them to fill the whole third of the gap that the U.S. might pull back from, but it is because this is happening, it might signal to these donors and these governments that they need to increase, they need to step it up, right? Because there is a gap to fill, and there are lives hanging in the balance globally that could, yeah.
And I should have mentioned replenishment. One thing, though, that could happen. So the U.S. is somewhat unique in how it does global health, in that it actually implements the programs. Other donor governments do to some extent, but not nearly like the U.S. They tend to put money into multilaterals. So if there is an interest in offsetting some of the gaps, the Global Fund might be a mechanism to do that, for example. So how this plays out, we don't know, but the replenishment is this later this year.
It sounds like there's really, really important lessons here for civil society in terms of making sure the public really understands the role of global health and its impact and what it's doing and how it's making everybody safer and more secure no matter where you are. And some critical engagement right now about how there's an opportunity here, as we're reimagining global health, about how to engage ministries of health and national governments and multilateral organizations, and thinking very carefully about what this new funding structure could be. I want to thank you both for your insights. It's been a pleasure, and let's do this again. We're going to have a lot of opportunities because this is going to be a fast-moving space. So thank you.
Thank you.
Thank you so much.